For millions of Americans, the healthcare crisis isn't some abstract headline. It's a letter sitting in their mailbox, a letter that tells them the cost of staying alive has suddenly become impossible. And you have to understand, this crisis wasn't caused by some market failure or an act of God. No, it was engineered piece, by very deliberate policy decisions. So let's break down exactly how we got here.
Okay, so picture this. It's November 2025. All across the country, families are opening their health insurance renewal letters for the new year. But instead of just some routine paperwork, what they're finding is a financial nightmare, a moment of pure sticker shock that threatens to unravel their entire lives.
Take a look at this number, 495%. That isn't just a random statistic. For one person getting subsidies in Atlanta, Georgia, this is their new reality, a nearly five-fold increase in their monthly health insurance bill for 2026. And this isn't some rare outlier. It's a snapshot of a nationwide emergency that's unfolding right now. To really understand the human cost here, you have to hear stories like Skylar Trujillo's. She's a mother in Florida fighting stage 3 breast cancer. For her, a $14 premium wasn't just affordable, it was literally a lifeline. Now she's faced with weighing the cost of her own cancer treatment against paying rent or putting food on the table for her kids. I mean, what kind of a choice is that?
And Skylar's story, unfortunately, is not unique. Not by a long shot. In Orlando, there's Nathan Boy, a father with diabetes, who watched his premium explode from a totally manageable $28 a month to an impossible $733. These are not just sad stories. They are the direct, entirely predictable results of a system being deliberately pushed to its breaking point.
So how in the world did we get here? This financial pain isn't random. It's the result of a very specific policy trigger, a man-made cliff that millions of people are about to be shoved over. Let's take a look at exactly how it works. This is it. This is the brutal reality for a family just like Nathan Boy's. In 2025, with financial help, their premium was $28 a month. In 2026, without that help, the exact same plan cost $733. The healthcare didn't change. The only thing that changed is that the policy making it affordable has just vanished. And here's the mechanism behind it all. It's called the subsidy cliff. For years, these enhanced tax credits put a cap on what families had to pay for their insurance. But now, those enhancements are gone. They've expired. So that means if your income is just one single dollar over a certain line, all that financial help disappears. Instantly. You just fall right off the cliff. But here's the thing you need to know. This cliff didn't just appear out of nowhere. It's actually the final move in a much longer game. This crisis we're seeing now is the totally predictable result of a decade-long strategy to systematically gut the healthcare marketplace, step by deliberate step. This timeline really shows you the blueprint for the collapse. It started way back in 2012, when a Supreme Court ruling let states opt out of expanding Medicaid. That fractured the whole system, right? It meant some states had a lot more sick people in their marketplaces, which drove up costs for everyone. Then in 2017, the penalty for not having insurance was killed. That was the main reason healthy people signed up, which kept costs down. After that, they slashed funding for the programs that helped people enroll in the first place. Each one of these actions weakened the foundation, leaving these expiring subsidies as the very last support beam holding the whole thing up. And as if that wasn't enough, just as millions are losing their ability to pay for their care, a second policy failure kicks in, almost like it was designed to make the financial damage that much worse. This is what turns a health crisis into a long-term debt catastrophe. So there was this new consumer protection rule that was about to ban most medical debt from ever showing up on credit reports. I mean, it makes sense, right? Getting sick doesn't mean you're financially irresponsible. But in July 2025, that rule was reversed. So just as millions of people are about to get hit with massive medical bills they can't afford, that debt can once again be weaponized to destroy their credit. And this creates what analysts are calling a poverty pipeline. It's a devastating feedback loop. First, the premium spikes force almost 5 million people to drop their insurance. Then, of course, an accident or an illness happens, and it creates a mountain of debt. That debt gets reported to the credit agencies, and bam, their credit score is ruined, locking them out of getting a car loan, a mortgage, basically locking them out of a stable life. So now you take these individual tragedies and you scale them up across the whole country. What you get is a national emergency that's crippling not just families, but our entire economy and our public health system. The scale of this is just staggering. We're looking at over $32 billion in lost revenue for doctors and hospitals, a nearly $8 billion spike in care that will just never be paid for, and a $40 billion hit to state economies. The ripple effect from all of this is projected to cost almost 340,000 jobs across the country.
And of course, this pain isn't spread out evenly. It's falling hardest on older adults who are getting close to retirement. It's hitting self-employed and disabled workers who absolutely depend on this coverage to work. And it's devastating Black and Hispanic communities, where an estimated 1.8 million people are projected to lose their insurance, just making existing health inequities that much worse.
So let's just be really clear. This disaster that's unfolding is not an accident. This is not some system that's just failing on its own. It is the direct, calculated outcome of a policy choice.
One analysis puts it perfectly. This isn't just a passive omission, it's an active mechanism. The decision to let these subsidies expire is the tool that is actively creating this financial pain for millions. It's not that healthcare is failing these families, it's that the politicians sabotaging it are.
And that leaves us with one final, fundamental question. This wasn't a market crash, it wasn't a natural disaster. It was a choice, built over more than a decade of smaller choices. So, when a health crisis is manufactured by policy neglect, who is ultimately held accountable for the human cost?